Hi guys, welcome back to another video. My name is Ether and this is Ether's Corner. If you haven't subscribed yet, go ahead and hit the subscribe button right underneath this video. So lately, I have noticed that most of my viewers are interested in how I passed my NCLEX in 85 questions. So I'm going to go ahead and hit 10 areas that you need to focus on to pass this NCLEX exam. There's going to be two parts to this study guide, part 1 and part 2. So I'm going to go ahead and give you part 1, and if you want part 2, subscribe right now. Okay, let's go ahead and get right to it. Number 1, know the different types of precautions. Especially during this pandemic season, you have to know the different types of precautions that's out there. Know what is contact, airborne, droplet. Know what type of PPEs that are required. Know how to put on a PPE, how to take off a PPE. In what situations would you sanitize your hands or do hand washing? How do you do hand washing? How many seconds? Number 2, know the vital signs of newborn, children, and adults, such as respiration, temperature, blood pressure, heart rate. Number 3, know the lab values, all of it. Red blood cell, white blood cells, electrolytes, liver function, urinalysis. Find a way to memorize it. For instance, there was this memorization that I tried to put in my head that really helped me. For example, like if I went to the grocery store, how many bananas would I buy? And it's about 3 to 5. So I will connect bananas to potassium, and I know that the value is between 3 to 5. Another example is creatine. Think of creatine as a creature, something that's very ugly. So you will rate it from 0 to 1. I found this on Pinterest. It helped me a whole lot in memorizing my lab values for my NCLEX exam. Hope this helped you guys. So that's a great way to memorize your lab values. Number 4, I want you to know potassium. What is potassium? Know everything about potassium, how it affects the patient, the signs and symptoms, what caused potassium to go down or up, the different types of treatments, what type of foods that has potassium. Number 5, know the frequent use medications and the effect that it has on the human body. Those medication includes digoxin, lithium, Lasix, morphine, aspirin, acetaminophen, which is Tylenol, nitroglycerin. How many times do you give it within the 5-minute interval? Number 6, study the endocrine system very well. Know what is Cushing syndrome, Addison, hyperthyroidism, Graves' disease. Know the overactive and underactive disorders such as ketoacidosis, diabetes insipidus, syndrome of inappropriate antidiuretic hormone secretion. Know the disorders of diabetics, the signs and symptoms, the causes, the treatments. Number 7, know how to calculate basic medications. The best way to calculate medication is to know what is prescribed over what is at hand, know how to calculate intake and output, what is a liquid, what is a solid, know your diabetic medication units, the different types of medication for diabetics. You have the short acting, long acting, intermediate, rapid. Know different situation, such as if the patient is about to go for a run, do they take the insulin or do they not take the insulin? Know how to calculate carbs intake. Number 8, know the roles of the nurse. For RN, LPN, and AUA, go with what's on the book, not what's in the real world, because I got confused many times because I was connecting what I see on the outside and I was wrong many times. So know the roles of the nurse and go by the book, because like I said, some facility may train RNs or LPNs to do certain things and the Board of Nursing do not qualify them to do that. But if they are trained to do something, they can do it. Remember that RNs get the most critical patients and they do the initial assessments. LPN follow up. They also get the less critical patients. AUAs get stable patients. You will never give a AUA a patient that is having shortness of breath. Number 9, know prioritization scenarios, such as if a patient comes into the hospital or clinic and they're having shortness of breath, and then you have another patient who was in a car accident and they probably broke the bone or something. Which patient would you care for first? So know your ABCs. Also know Maslow hierarchic chart. Know that the basic needs comes first before anything else. If there was an emergency situation and there were many people that was hurt, which patient would you leave behind? Which patient would you care for? Know those things. And lastly, number 10, know how to care for a seizure patient. I studied this many times and also saw it on the NCLEX. So know how to take care of a patient who is having seizures. Know the different type of seizures. Also know the procedures that you have to do while that patient is having a seizure. Like you keep the head flat, you do not put anything into their mouth, you clear the area, and you also time the seizures. This is my top 10 study areas that I think will benefit you on your NCLEX exam. Now, like I said, this is part 1. I am going to go ahead and prepare a part 2. So if you want part 2, remember to subscribe right now. If you have an NCLEX exam coming up, remember that the NCLEX focuses on if you are a safe nurse. So don't sweat it. Take your time, don't rush, and you'll do well. Before I go, remember to subscribe, comment down below, give this video a thumbs up, turn on your notification bell so you won't miss another video from me. Thank you for watching Eda's Corner, and I'll see you next time. Bye!